This was a very shocking night, and as you can imagine, a very scary experience for everyone who was inside.
Standing up to hate, Ian Grillett was shot after a gunman opened fire inside an Olathe bar.
That's why I'm very grateful to be alive. I was told I was very lucky.
The gunman targeted 2 men, killing one, injuring another, before Grillett heroically stepped in.
I couldn't let the opportunity of him going in and hurting a family. It wouldn't stand all right with me. I had to do something.
Where is he now? We check in with Ian and look back on that night and the time he spent in our care. Good morning. It is Friday, January 13th. I'm Jessica Lovell. Welcome to the Morning Medical Update and to the Dulcie Simons Jr. Family Broadcast Studio. Ian Grillett was just 24 years old at the time of the shooting. He was hit with a single bullet that injured his hand and his chest. We hear from him and find out why the bullet was never removed. Make sure you get your questions sent in to us on YouTube, Facebook, and the Medical News Network. You can find links to all of those right there on your screen. In our morning rounds today, First Lady Dr. Jill Biden underwent surgery this week after doctors found a small lesion above her right eye. It was found during a routine skin cancer exam. The procedure is known as Mohs surgery, and we want to bring in Dr. Jesalyn Tate, Director of Dermatologic Surgery and Mohs Micrographic Surgery. Dr. Tate, good morning to you. Exactly what is Mohs surgery, and is it pretty routine?
Good morning. Yes, so Mohs surgery is a specialized skin cancer removal technique. Not every cancer is going to qualify for Mohs surgery or needs Mohs surgery, but whenever we do it, it's really for those cancers in the cosmetically sensitive areas or the areas where we don't have a lot of extra skin. And so with it, what we do is we numb people up just like they did for their biopsy at the time of diagnosis, and then we remove that skin cancer. And we take a very narrow margin with Mohs surgery, so we're able to save that normal healthy skin. And then we process that in our lab. We freeze it, we stain it, and I look at it underneath the microscope, and we make sure all those skin cancer cells are gone. And we keep going with that process until the patient is cancer-free and there is no more cancer cells remaining. As soon as we're done there, then we get the patient back together. And so Dr. Jibby is our other Mohs surgeon, and of course myself, we're trained in cosmetic reconstruction as well after Mohs surgery, so making sure patients get a good long-term outcome.
So, Dr. Tate, during the First Lady's pre-op screening, there was a second area on her chest that looked kind of concerning. Doctors removed it and found it was basal cell carcinoma. So does that mean that Dr. Jill Biden has skin cancer? Because that sounds serious. Are there further concerns?
Yeah, great question. So yes, basal cell carcinoma is a subtype of skin cancer, or a type of skin cancer, I should say. It's actually the most common type of skin cancer. We see it very, very commonly. It's definitely the most common that I treat. And you know, the good thing about basal cell, it's a low-risk skin cancer as far as things go. It's not kind of the scary one we hear about, spreading and metastasis and all those scary things we hear about with melanoma. Basal cell is generally low risk. However, it can be locally invasive, so we want to make sure we get that skin cancer out with clear margins, just to make sure it doesn't cause the patient long-term problems.
And you and I were talking before the program, and I told you that I had Mohs surgery because I had basal cell right smack dab in the middle of my chest. Very noticeable. That was about 10 years ago when I had Mohs. I'd never heard of it actually, but I thought, hey, if that's what we got to do to get rid of it, let's do it. So has it advanced at all in that last decade, or is it just more common and people are more aware of it?
Yeah, a little bit of both. So definitely it's more well known, I think, as a skin cancer treatment. There's more fellowship trained Mohs surgeons now in the country than there were 10 years ago. So I think the importance of fellowship training with Mohs surgery has been really well recognized, and knowing that your doctor has really been trained to do your skin cancer removal and to do your reconstruction. And so I would say in ways the core process of Mohs surgery hasn't changed in the last 10 years. I don't think it's changed in the last 30 years, but I will say we're treating more cancers than ever before with Mohs. We're using immunostains now to treat melanoma and other rare cancers. So I think it's becoming more widely available, more well known, more recognized, but also I think we're advancing our techniques with treating more rare or more challenging skin cancers.
Like skin cancer screenings, it's year round for you and certainly for all of us, but as we start getting ready to think about spring and getting out in the sun more often and planning those trips out in the sunshine, just give us some warnings, what we need to think about, and certainly just a good reminder about getting screened and getting our skin checked.
Yeah, so I think, if you're in your 20s, 30s, and you haven't had a baseline skin check, I highly recommend it. I think it never hurts to get your skin checked when you're younger, and especially if you're older than that, definitely set yourself up for a good check over. With a board-certified dermatologist, you're getting the best care. You're getting really a good close look at all of your skin lesions, making sure there's nothing to worry about. And then for each patient, it's different. We say, hey, we don't need to see you back for a few years for another check, or sometimes we want to see them back really frequently depending on how high risk they are for skin cancer. And we kind of make that determination based on the patient's age, sun exposure, and what we see whenever we look at their skin.
Okay, I'm maybe a couple months past my year exam. I'm very good about getting it, so I'm going to make a note, and I will make my appointment, I promise, Dr. Tate, when I get off the air, okay? I'll come see your team. Thank you so much for being with us this morning. Good to see you.
Yes, thank you so much, and don't forget your sunscreen.
Absolutely, all the time, every day, all day. Well, it's been almost 6 years since a triple shooting inside an Olathe bar. You may remember this story. Adam Purinton opened fire February 22nd, 2017 at Austin's Bar and Grill in Olathe, killing one man, injuring another man. But Ian Grillett, he was shot when he tried to intervene. He survived. Purinton pled guilty to first-degree murder and 2 counts of attempted murder and was ultimately sentenced to life in prison. Today, we are pleased to have Ian join us today, along with Dr. Cameron McCoy, trauma surgeon and associate trauma medical director here at the health system. Dr. McCoy, good to see you. Thank you for being with us.
Good morning.
Ian, I have to start with you. Always such a story that so many of us remember. Almost 6 years ago, as we mentioned, this bullet barely missed your carotid artery. Take us back to that night. What do you remember most?
Biggest thing I remember is just the whole atmosphere. It was a beautiful February evening, very warm outside. Families all out and enjoying their evening, having dinner, watching the KU basketball game, and I don't know. It was just a very bizarre, and unfortunately, we find every day it's a growing issue we have in this country. Just the senseless acts of hate. And unfortunately that night, it struck the heart of Olathe. Just wild night, blessed to be alive, and the fact that, it was only one person that survived was a miracle.
It was, and it's okay to have your little one join us. I was going to ask you what you've been up to. We're going to find out more about that, but I see what you've been up to. You've been a busy dad, and that's so great to see and learn. Your child is welcome to join us this morning. I was going back when we were looking at footage from that time when you were in the hospital here with us, and it just it kind of got to me a little bit just hearing you kind of recount how you were just like, I wanted to step in, I couldn't watch. I think we all wonder what we would do in those situations, and you're kind of living proof of what someone would do and what they would hope to do. What made you step in?
The biggest thing was I was at that establishment very frequently. Austin was almost like a second home. The patrons there. There was a camaraderie, a family, but with going there so frequently, there was a back door that I very often went in through the back door along with a lot of other people, and that was my biggest fear. Was that he's already tried to kill 2 people. What's going to stop him from trying to go in that back door? And from what my understanding was, he was a regular there as well, so he is well aware of the door and the entrance in the back. There's actually 2 of them, and so that was one of my biggest fears. I knew initially during the shooting when it first happened I couldn't do anything, because if I didn't stop him, he would then turn and shoot at me and everybody sitting around me. So there was that kind of horrifying event of having to just wait until he moved. But then I knew from there, once he put the gun down and tried to flee, I had to do something to stop him. And hope that, he wouldn't make it in the back door. And because if he did, there was so many families and, friends and just people enjoying their Wednesday evening. We don't always get beautiful Wednesday nights in the state of Kansas in February. So, everybody was out enjoying themselves, having a good time. And it could have been much worse. Just, I guess, is what I'm getting at there. And that's why I knew something had to be done. And, I would hope anybody would do that to try to prevent the loss of life.
Well, I want to turn to Dr. McCoy. And Dr. McCoy, I know you weren't directly involved in Ian's care that evening and the days following, but this is the type of event that your trauma team routinely treats. Ian had a lung collapse when this bullet hit his chest, also had a fractured vertebrae in his neck. How do you treat that? How do you assess that when something comes through the door? And I want to talk a little bit more about will lead us down the path of a level 1 trauma center and why that's so important to treat these kind of injuries. But how do you assess that when it comes through the door?
Sure. When a patient arrives at our trauma center, they undergo a rapid assessment and initial stabilization of their injuries by the trauma team in the emergency department. That's a multidisciplinary team. And for a patient like Ian with the injuries he had, he would have received initial resuscitation, often with rapid blood transfusion, placement of a chest tube to re-expand his lung, and then potentially emergent surgery to correct the injured organs and tissue as well. And with regards to his neck injury, he would have been had his neck stabilized and been immediately evaluated by one of our spine specialists as well.
So, Ian, we spoke with you while you were in the hospital. You saw that video off the top of the program. We were, a lot of people get shocked when they hear that there was a bullet still inside your chest. Let's listen in on how you described that feeling.
It doesn't feel good, to put it a nice way. It's definitely an odd feeling. I figured, all the movies are like, oh yeah, they pull it right out, but I guess that's not the way to do it. So it's definitely odd. It's not pleasant, to say the least.
Ian, is the bullet still there?
Yep, still hanging in there. So my little bitter reminder that, as much as I like to believe the world's a perfect place, it's not always so perfect.
So, Dr. McCoy, that's the question. What would be a typical reason for leaving a bullet in? We've heard those stories where the bullet's, maybe in somebody's brain, and it's better to leave it in than to take it out because it poses risks. What are those risks, and why would that bullet still need to be in there?
So it's a common misconception in the popular media and film that removal of the bullet is the step in someone's trauma care that somehow miraculously gets them better. Mm-hmm. In fact, it's actually the repair of all the injured tissue through which the bullet has traversed, that trajectory, that in fact gets the patient better. And the stable ballistic is in fact a very low risk thing. Now, there are certain situations where we do remove bullets in joints in specific areas of the body where there's a higher risk of things like lead toxicity. But what people don't realize is the vast majority of retained bullets are left in place for years at a time with no ill effect.
So, Ian, that bullet pierced your chest, but also your hand. We want to take it back a little bit and listen to how you explained the injury from your hospital bed.
The doctors said I was very blessed to not have pieces of bone missing, it all being intact for the most part. Obviously, it's a little battered and bruised, but it's all there. So I'm very thankful. I'm very blessed for how everything turned out. Granted, some may not see it as a blessing, but I'm very lucky to be in the state that I'm in for the circumstances of what happened.
Ian, you worked in construction before this shooting. Are you still able to do that type of work with that injury?
No, unfortunately, I'm right-handed, and that's where the bullet had initially entered through. And after a certain amount of time, I kind of feel strain in my right hand and then my chest as well. So no longer able to do that, but I do now. I'm currently working within the IT industry, giving people an opportunity, either if they're already in the country or to come to this country. And it's actually pretty special to me because the Indian community has, they welcomed me with open arms. The compassion and love that I felt, it's hard to describe and put into words. So the fact that I'm able to do what I do now, working with a lot of the Indian community within the IT industry, it's kind of all come full circle, I guess you'd say. And it's very rewarding knowing, getting to help people try to make their American dream happen.
Gosh, I love that. I love that part of your story. And we're going to get to more of that here in just a second. I do want to ask, though, well, first of all, Ian, did you have plastic surgery done on your hand? Were they able to repair it and
yes.
get you back in working form?
Yeah, as good as they could do for the circumstances, mm-hmm. obviously. But the biggest thing with my hand was it could have been a totally different story depending on the type of round used, and it was a full metal jacket, and that, from my initial understanding, that's what kind of probably saved my life. The fact that it was a full metal jacket and the round didn't essentially mushroom out and open up to where my hand, it was one bone broken versus being completely shattered. And then same going with where it entered into my chest afterwards. Just one of those things, there's a lot of variables that went into that night and how it all ended, and the round being one of them. So yeah, the fact that there wasn't more damage done was truly a blessing. So yeah.
So, Dr. McCoy, 3 people were shot that night, 2 survived. That makes for a busy time frame there in the trauma department. Tell us a little bit about what it means to be a level 1 trauma center. We hear that word, but what does it mean to the public, a patient, someone like Ian?
So as a member of, as a trauma surgeon here, as a member of a very large trauma team, it's comprised of many specialties: emergency department providers, OR providers, ICU providers, and all of the support staff and other service lines that go into supporting us as a level 1 trauma center. And in addition to having those people available, they're available 24/7, 365 as well in-house for the service of these trauma patients that come in. In addition, these teams are undergoing constant training. We have significant resource availability with regards to blood bank capabilities, radiology capabilities, and finally, they're basically ready on the spot within 10 to 15 minutes of an ER code being called out by EMS, where they are ready to receive the patient, which is not true of many standard ERs in this area.
So walk us through that communication, because EMS arrives and then they're making that minute-to-minute decision. Because if you just look at the map, you've got Olathe down here, and then you've got KU in one spot, and then you've got other places and other hospitals in between. How do they make that decision and communicate with our teams to know, do we take them to the closest, or do we take them where he may be able to get a deeper level of care?
Mm-hmm. So the state of Kansas actually has a well-organized trauma system in place that involves knowledge by both EMS providers and hospital providers of where trauma centers are located and their capabilities. And on top of having that already in place, there's real-time communication between all of these centers and EMS agencies about the volume of trauma going to specific locations. So in real time, these EMS providers and dispatchers can send those units to the appropriate hospitals where they can perceive that have the capabilities to care for those patients. And that can change on a minute-to-minute, day-to-day basis.
We have a QR code on your screen. It'll share more information about what it means to be level 1 trauma here in this area. You can scan it to see really just the incredible work that our healthcare teams do every single day. Ian, part of this, where are they now? We want to know what you have been up to, and we can tell by in the background your kiddos, how your life has changed over the past 6 years. So just tell us about this family of yours and what you've been up to.
I met my wife about 6 months after the shooting happened at a golf tournament, which I am no good at golf, but it's, I enjoy it. It's fun. And it actually introduced me to my best friend and my wife. We got married July 4th of 2020. And COVID, unfortunately, put a little damper on that, and we had to do a little small wedding. And then we did a bigger one last year, but now I've been blessed with 2 beautiful boys. I got Theodore James and George Richard. And, it was very hard for me, actually, because Srinivas and Sunina, that was their goal, was to start a family. And that was taken from them. And so it took me a long while to be kind of okay with everything, and just perspective and how I viewed it. It took a lot for me to get over that. Still struggle with it at times, but I got to live my best life for Srinivas. And this little guy helps keep me grounded, that's for sure. But since then, work-wise, I wasn't able to do the same thing I was doing. Obviously because of the injuries, and in turn I started working within the IT industry, as I was saying earlier, and just really truly has been a blessing of just everything kind of going full circle, I guess, of working within the IT industry where it's predominantly the Indian community, and just the way they reached out and considered me family, and with open arms. So it's truly been a blessing of just life, because it goes to show you I had the reminder of anything can happen at any time. No day is guaranteed, and so just live each day as it could be your last, and just enjoy every bit I get. So yeah. It's been beautiful, to say the least. There's hard times and everything in life, so just gotta truck on through.
Well, and I appreciate you being candid about that, because it's you living your best life, and I appreciate you bringing up the gentleman who lost his life and just living your life through him. I think that really resonates with people. And I'm going to ask you to do something you probably don't want to do, and that's kind of brag on yourself, but I will tell you, your wife sent me a lovely text yesterday talking about the award that was well earned and deserved that you received. Brag a bit on yourself, but I'll just say it was your wife who did all the work on that.
Well, that award is it's called the Lewis E. Peters Award. It's a joint award between the FBI and then the Bureau of Former Agents, and that was through some of the team in Kansas City, the FBI team that was directly involved with that case. They had nominated me for it for just going above and beyond and trying to stop and doing whatever I could to help with the case, I guess you'd say, because justice needed to be served. And unfortunately, but fortunately at the same time, I guess you'd say, with our legal system, it's a due process. And without certain information, things don't always get tried the way they should. And so that was kind of pertinent for the justice for Serena Voss to make sure that happened. And in turn, that's how I was given that award. And it was such a special time when I was down there. I received it in Florida, and I actually met a lot of different agents that served in Kansas City, whether it be back in like the 80s or somewhat more recent. But it was really special, and some of the people I met and the camaraderie that I made of my Kansas City crew, as we called it, it was very special. And just the award, that was all secondary to knowing justice was served, and justice being served, it still doesn't bring back an innocent life that was taken. And so unfortunately, that's kind of a bittersweet reminder. It's actually right there behind me, and along with some of my other plaques and awards that I was given after everything. But it's kind of bittersweet seeing things like that, because I would love for none of that stuff to be on the wall behind me and never have gotten that award to have Serena Voss back. For his wife's sake, who I've actually became really good friends with, Sunaina. She is such a beautiful woman, and like soul is, she's awesome. And it's tragic that her life was essentially cut short, even though she's still alive. The life of her love is gone. And so that award, it means a lot, but it's also kind of a bitter thing to see sometimes for me.
Well, it's the highest citizen award that the FBI gives out. Your wife went on to tell me, she goes, I don't want it to come off that I'm bragging and gloating about it, but says that you're very humble about it, and I think we see that now. But she said you tend to downplay it, but you explained it so beautifully, and we appreciate it, and it's just a well-deserved honor. So, but bittersweet,
Thank you.
Nonetheless. I want to take a quick break, check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, just get a quick check of our numbers before we head into the weekend. Good morning.
Yeah, such a great story right now. Obviously, so much tragedy, but certainly some great things have come out of it too. And as we shift now back to COVID real quickly, so our active count has gone down, a total of 61 patients in the hospital, but of those, just 31 active, which is good news from the last couple weeks. Still 5 in the ICU and 2 on the ventilator as well.
All right, do we have any reporter questions on the line today? All right, let's get to our viewer questions. Rod wants to know how long you stayed in the hospital, Ian.
I was in the hospital for about 6 days, and I kind of got out a little early, I think, just because I was so adamant on I want to go home. I want to just get out of this place. I can't thank KU Med enough for everything you guys did for me, saving my life, and making it an easier process. But I just wanted to get home, and so it was about 6 days that I was in there, and then luckily I made some friends there at KU, and I was able to get snuck out the back door. For the fact that the media was kind of all over, just trying to get some insight on how I felt, and this, that, and the other. So yeah, about 6 days.
All right, question from Isaac. Have you been back to Austin's Bar and Grill since that event?
Yes, I have. Some may call me crazy, but that place will always hold a special place in my heart. Unfortunately, it has this mysterious way of changing things. So some people no longer go there, have moved away, things like that. But even without the people, there's always that special connection to the place. I don't know if it's the memories prior or because I almost died there. I don't know. But I will always have a special place in my heart for that place, being the people of old and some of the people of new. But yeah, definitely have been back.
I bet. Yeah, I bet you've run into my sister and my brother-in-law. They hang out there a lot as well. And I always am like, why are you always at Austin's? And now I realize it's kind of, there's this camaraderie there that's like their favorite place to go. There must be a connection of people out there. I now see and understand it. Becky wants to know how you've recovered mentally. You touched on it a little bit, that you're struggling a little bit, but that you're finding ways now in your current time to kind of make peace with it in some ways. Tell us a little bit more about that.
Yeah, so I mean, one of the good things about time moving forward is mental health is becoming a lot more of an acceptable thing, I guess you'd say, because for so long there's always been the stigma that men have to be able to, push through. Men are okay, men are tough, men are strong. But all people, mental health is such a huge thing for everybody. I don't care if you're the toughest man on the planet or the strongest woman on the planet. Mental health's a big thing. And so it took me about 5 years to really acknowledge that I needed some assistance. I needed some tools. I needed guidance on how to help myself. And it was definitely an uphill battle. Still is. I'm not going to say it's gone and over with. Unfortunately, that's one of the things you'll probably carry with you. And in a situation like this, but just accepting and understanding the things that you can't change, because that was always one of my biggest things, was I wish I would have done this, or I wish I would have done that, and then when you wish that, then it's the what if I did that? Would Serenivos still be here? What if I would have done this? Would he ever even came back and tried to harm them? And that is one of the more dangerous things about the mental health thing, because those are the questions you can't answer. Unfortunately, there is no answer for it, and the answers for it happened almost 6 years ago, and there's no going back to that. And so, yeah, that's been the biggest thing with the mental health side of things, is accepting and realizing the things that you can't change and kind of trying to stop dwell on those issues. And I don't know how else I'm going to say it, but on that note, though, that night, everybody had labeled me as a hero, and I've said it many a times, I'm not that. The real heroes there that night, and I've never really had a chance to say this, were the people that tried to save Serenivos' life, the people that helped save Alok's life, and the people that helped save my life. Those were the true heroes in that situation. And, excuse me. They...
Take your time to share. It's okay.
I feel all those people have been struggling in silence. And that hurts. I myself wasn't going to do this. But But yeah, that's one of the harder things for me with all of it. A woman lost her rock, her better half, and there was a lot of people that never truly got the help I feel they need. Not need, because it's still an issue. And it's always hurt inside, the fact that so many people that night went above and beyond what any U.S. citizen just living their life should be asked to do. These people didn't sign up for the military. They weren't EMT. They weren't police. They just did the right thing.
Thank you so much for bringing that up, and that's why I want to bring in Dr. McCoy. Take a moment in, because I just want to hear your thoughts about that, because it touches so many people, the first responders, the people in there who, again, didn't ask to be in this situation. Just what are your thoughts on that, Dr. McCoy?
Well, I think for so long, trauma and trauma care is focused on the medical care of patients, and I think there's so much more attention now being spent on the effects of the acute stress on both providers, bystanders, and, like you're saying, citizens in the community that are the first line of care for a lot of these patients in these situations. And I think we've only begun to recognize and begun to figure out how to offer the most support for those individuals. And I think that's going to be a really important part of trauma care moving forward.
Right, not just in that moment, but the years following, and really ongoing forever. So Ruth Ellen had a comment, Ian, and she said just when something like this happens in the community, we don't always get a chance to follow it through and hear stories like yours and how you're doing. So she just really thanks you for sharing your story, and so do we, and being such a great example of, like you said, not just what you stepped in and did that evening, but what you're doing now, and using that horrific event to touch more people's lives and talk about mental health and really be that model for that. So we appreciate you so much, and we are so glad you are doing well, and so great to see your beautiful wife and your kids and your long beard and all the things and all the fun changes that have happened with you. And you are welcome back anytime to share anything that you want to talk about. But I want to get some final thoughts from you. Just anything that you want to say, anything you want to share. The floor is yours.
Just a big thank you to the team there at KU Medical Center. The treatment that I received, the care that I received, everybody from the doctors to the floor nurse. It was a very, very tough time, obviously still affecting me to this day, but during that immediate time, I had the best care I could have asked for, and just everything that went through, words sometimes can be difficult after a little tear happened. Everything that had happened that night, and the craziness that I'm sure was, in the ER and everything like that. When I was there, Loke was there, Serenivas was there, and just the cool, calm collectiveness of the doctors that were, saved my life, to help save Loke's life, and tried to save Serenivas's life. Just a big thank you from my heart, and I know Alok and Serenivas's wife or widow, Sunaina. I can't thank everybody enough, and just the care from everybody, the prayers, the well wishes. It was felt, and yeah, that was very hard to kind of put into words, I guess, what I'm trying to say. But just thank you to everybody and those there that night that helped save my life and Alok's life, and tried to help save Serenivas's life, and just were rocks for their friends or family or neighbor or acquaintance when they needed a shoulder to cry on, because we grieved that night as a community. Latha really did come together, and it was a beautiful thing. Unfortunately, it was caused by tragedy, but just the way everybody united, and it seemed like everybody kind of linked hands and came together as a community. We just don't see that anymore these days, and unfortunately, when we do, it's always after a tragedy. Why that can't happen just out of the good of everybody's heart to come together, I don't know, but hopefully we can get there someday.
Really well said. This is a story that has stuck with our community, and I do think has connected us, not just that night, but over the last 6 years. And promise me you'll come back, and we can find out where you are now, and several years from now, doing well. Okay? Promise you'll come back?
Of course. Just let me
Great to
know
see
when.
you, my friend. Thank you so much. Live well.
Thank you.
Do what you're doing. Dr.
appreciate
McCoy,
it.
your
Thank
final
you.
thoughts. Hard to follow that guy.
Absolutely. I would just say, we're thankful for Ian and all the people that provided care that day, and I'm just very proud to be a member of this trauma center serving this community.
Yeah, thank you so much for your insight and talking with us today. Good to see you. Have a great Friday. Dr. Hawkinson, final thoughts before we head into the weekend.
I mean, again, definitely difficult to follow that incredibly tragic story, but also there is some happiness to come out of that and thankfulness. But I would just echo, our surgeon's words as well. Just so happy to be here with this team of collaborators. So many disciplines coming together, no matter what the ailment is, whether it's trauma, cancer, infection, all coming together to really try to get you better, get your quality of life better, get you out of the hospital and back home with your loved ones.
Ian, so many beautiful just messages and thoughts to you, and thank you, and God blesses to you. So I just want you to know that your community is hearing you and your words, and hopefully are better because of it. So thank you very much, and thank you all for being with us today. You can catch our updates anytime by logging back onto Facebook, YouTube, and Twitter. We won't have a new program for you on Monday, of course, because it's Martin Luther King Jr. Day. It's a day of service, so get out there and do it well. But join us Tuesday for an encore presentation, and then Wednesday for a live open mics with Dr. Stites. Everyone, go out and make it a great weekend. Is 10,000 steps a day really the magic number? We know walking improves cardiovascular health and reduces the risk of dementia, but how many steps do you really need to feel the benefits? On the next Open Mics with Dr. Stites, our experts weigh in on the recent study. See you Wednesday at 8.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.